COVID-19 pandemic is as bad as it's ever been. Luckily, thanks to groundbreaking work from the scientific community, help is at hand, with new vaccines now being rolled out across the UK.
As we saw last year, the coronavirus can be particularly deadly in care homes. That's why the government has prioritised older residents and the care home services and the staff who support them in the first phase of the rollout. There's been a lot of scaremongering stories, but almost all the staff here in Lanark have the vaccination.
That's not true. Neither of the vaccines being used in the UK are live vaccines containing COVID-19. This means that you can't get COVID-19 from the vaccine. I got my jab myself the other week and the only side effect was a sore arm. And it was really sore. But it only lasted about 1 day.
Both vaccines are being thoroughly tested in clinical trials involving thousands of people. All vaccines have to be tested by the MHRA to make sure that they're safe before they can be used on the public, and these ones are no different.
I was queuing up to get my vaccine. Then the nurse asked if I'd any allergic reactions in the past, and I had, and they said I should wait and get the Oxford one instead. I was upset at the time. I couldn't get it, especially being in that category where it could be dangerous for my age group. There's now been a development, and the NHS have come back to me to tell me that the Pfizer vaccine has now been deemed safe to give to people with allergies. So I'll be getting it along with 4 other staff who was in the same boat as me first time round. It's the only way to go. I'd advise anybody that's worried about it to speak to NHS staff, speak to your liaison officers. They're the experts, and it's good to know that they're taking allergies seriously.
There's no evidence that states that the vaccine will make you infertile. It just hasn't been tested on pregnant women yet, which is why they're not recommended to have the vaccine unless they're in a high risk category. If you're pregnant like me, the best thing to do is follow the guidance and speak to your line manager and your GP, and they can guide you and give you the right steps on how to keep yourself and your baby safe. For me personally, I won't be getting the vaccine at the moment until after I've had my baby, but once I've had my baby, I'll definitely be getting the vaccine. So why should you get vaccinated?
The vaccine is the most effective way to protect your body from COVID-19. It reduces your chances of getting it, and it makes your symptoms milder if you do catch it. Along with other steps like social distancing and wearing PPE, it will help keep you and other people around you safe.
We're still waiting to see the full impact of the vaccine on transmission, but the early signs look really positive. The people we support are often vulnerable, and I want to reduce their risk of getting it as much as possible. The best way to do that, and to give peace of mind to their loved ones, is to take the vaccine.
The health and social sector is under an enormous amount of pressure when there is an outbreak at a service. It creates real problems for staffing and has a knock-on impact on the quality of care we can deliver. Taking the vaccine reduces the risk of me having to go off work, which is better for my team and provides continuity for the people we support. After having the vaccine, I am more confident supporting people in their own homes. I cannot understand why anybody would not want 90 to 95% protection against this virus.
That's why I'm getting the vaccine.
That's why I'm getting the vaccine.
The vaccine is such an important tool in the fight against COVID-19. It is the first step back towards normal life. We need to take it when we have the chance. That's why NHS Scotland strongly recommends you to get the vaccine when you're offered it.